Omicron variants that we saw earlier this summer. This continues a trend of variants that are evolving to become more transmissible, but are not producing a greater severity of disease. The fact that the virus is more transmissible, though, really should be something that we take seriously. Even if you have only mild symptoms of COVID, it certainly can disrupt your life, as hopefully you'll be conscious of staying away from others while you're sick. Nevertheless, we still see an average of more than 200 hospitalized patients with COVID-19, and sadly, an average of 17 deaths each week. These numbers are a stark reminder that if you spread the virus to a family member or friend who's in a high-risk category, such as someone over 65 or those who have impaired immunity, a COVID-19 infection could be a very serious threat to their health. The good news is that we have a very safe and very effective vaccine to prevent this illness and lessen its impact. You've heard me say this many times, but the fact is, the best way to protect yourself and others against COVID-19 is to make sure that you are vaccinated. Last week, the U.S. Food and Drug Administration approved an updated COVID-19 vaccine for the 2024-2025 season. The vaccine is formulated with more recent variants in mind, especially the JN1 and KP2 lineages. These lineages are either currently circulating or very similar to some of the other variants that we are seeing circulate, affording those who get the updated vaccination enhanced protection. The CDC recommends that anyone ages 6 months or older who has been previously vaccinated receive 1 dose of the new 2024-2025 vaccine. At this time, the CDC is not recommending that those over 65 get a second dose unless they are immunocompromised. Some locations now have the updated vaccine available, and we expect availability to increase as we move into September. We advise you to check with an individual location before going to get the vaccine. Also, the vaccines.gov locator tool will be updated soon. The rising number of COVID cases also illustrates the value of having COVID tests on hand at home. Now, these tests are sold in stores and pharmacies and remain free for those enrolled in the Medicaid program. Also, the federal government recently announced that it will once again provide free COVID tests. Starting in late September, Americans will be able to order up to 4 tests per household through covidtest.gov. Tests are an important tool, not just so you can protect others, but also in determining whether you might benefit from treatment. Our own governor, Mike DeWine, announced last week that he had tested positive for COVID and was treated with Paxlovid, an antiviral medication. I'm happy to report that the governor is back to his normal, very full schedule this week. Paxlovid has proven to be safe and effective in reducing hospitalizations. It is important particularly for those who are in high-risk categories. But it's important to note that it requires a prescription and is most effective if taken promptly after symptoms first appear, which is within 5 to 7 days. Along with COVID-19, we also need to be thinking about some other respiratory viruses. By this time next month, we'll start into our annual respiratory virus season, which means it will also be important to look at getting your annual flu shot. Those are reformulated every year, and the new formulation should be available in September as well. If you are going in for a COVID shot, consider a twofer and get both a flu and a COVID shot at the same time. Along the same lines as COVID and flu, another very important vaccination to consider right now is the vaccine for RSV. The CDC recommends an RSV vaccine for anyone age 75 and over, or for those 60 to 74 if they're at increased risk because of certain underlying medical conditions. This is not an annual vaccine. So if you've received an RSV vaccine, you do not need a new one. If you have not received it, though, now is the perfect time to go and get one. There are also RSV vaccines for pregnant women and a shot for infants. Now, if you're pregnant, I encourage you to talk to your provider about this vaccine. It's called Abrysvo, and it can protect your newborn child from RSV, a virus that hospitalizes far too many infants every year. The CDC says that women who will be 32 to 36 weeks pregnant anytime between September and January should get this vaccine. Now, if their mother did not get an RSV vaccine during pregnancy, the CDC recommends a different RSV shot, Nirsevimab, for all infants younger than 8 months of age born during the RSV season, that's October through March, or who might be entering their first RSV season. These shots are very important. Too many young children end up hospitalized and very sick at the start of their lives due to RSV. Vaccines can help prevent that. And the point that I will make today about vaccines is, as much as we talk about respiratory viruses and recommended childhood vaccinations, all adults should also make sure they're up to date with their recommended vaccines. For example, the DTaP vaccine protects us against tetanus, which is an environmental disease that can cause severe illness, as well as protecting us from becoming a spreader of pertussis, or whooping cough, which can be very serious if it is caught by young children. Now, before we welcome in our guests today, we all need to remember that COVID-19 can leave behind a constellation of lasting symptoms and problems that are now known as long COVID. And long COVID can be debilitating. There's good news, though. In July, the New England Journal of Medicine published a study that showed that rates of long COVID were markedly lower among people who had been vaccinated. We already know that vaccination helps lower the chances of contracting a severe case of COVID. Now we know that it helps protect against long COVID as well. To dive a bit further into a discussion of long COVID and vaccines, I want to welcome in Dr. Joe Gastaldo, an infectious disease specialist and vice president of clinical affairs for Ohio Health Dublin Methodist Hospital and Ohio Health Grady Memorial Hospital. Dr. Gastaldo, I just referenced the New England Journal study on long COVID. What more could you tell us about long COVID? What is it? What have we learned about it recently? And what's the role of vaccination in protecting us?
Thank you, Dr. Vanderhoff. Well, long COVID we've heard about before and was first identified during previous surges we've had. Long COVID is basically a constellation of various vague symptoms that roughly 1 out of 10 or 2 out of 10 people will have, oftentimes for many months. Most of the time, the symptoms eventually go away with just supportive care. However, the symptoms can be quite debilitating. They are quite vague. They can involve mental fogginess, chronic cough, shortness of breath, heart palpitations, and even gastrointestinal complaints. What causes long COVID still, we really don't know. There's a lot of research going on through the NIH and the federal government. It's hypothesized it may be related to an immune dysfunction or perhaps even a nervous system dysfunction. The point I want to emphasize is something you said a few moments ago. The best way to protect yourself from long COVID is to stay current on your COVID vaccines. That is the most important thing, I think, for the public really to understand about long COVID. If you are up to date on your vaccines, you are statistically much less likely to have any type of lingering symptoms from COVID-19.
You know, Dr. Gestaldo, many people in Ohio have had a COVID shot or multiple shots in the past and may really be wondering about that advice that we've been offering about keeping up to date on their COVID shot. Why is it important for people who may already have received a COVID vaccine in the past to be getting another COVID shot this fall?
Again, Dr. Vanderhoff, a great question. And I'm going to do the analogy like influenza. The virus that causes COVID-19 is not going anywhere. And like influenza, the virus that causes COVID-19 changes. And that clearly has been proven with what we know about COVID-19. I don't really see that changing. And when it comes to the vaccines do lose their efficacy over time. And the fact that we have a new virus that changes over time, just like influenza, that's the real importance of staying current on your COVID-19 vaccines. That's specifically important for people who have at-risk conditions. You mentioned a few moments ago about hospitalized patients with COVID-19. At Ohio Health, the flavors that we're seeing for people in the hospital with COVID-19 are the elderly, those above 75 and higher, those who are immunocompromised, and those with really what I call frail medical conditions like advanced asthma, advanced emphysema, advanced heart disease, advanced diabetics. Those frail individuals who really don't have a lot of reserve and can get sick from any type of insult.
Thank you. That's very, very helpful, Dr. Gestaldo. Now, I spoke in July about back to school health and wellness, focusing on the importance of keeping kids up to date on their recommended vaccinations. Because the school year has only just begun, I'd like to talk a little bit more today about student wellness and the ways that parents and caretakers can help our children get off to a good start. To help us with that, I'd like to welcome our next guest, Dr. Vanessa Meyer, Medical Director, Metro Health Medical Center's School Health Program. Dr. Meyer, welcome. And as a pediatrician whose professional work focuses on keeping children healthy at school, what would you share with us and with the parents about the role vaccinations play in keeping kids healthy?
Well, thank you, Dr. Vanderhoff. This is such an exciting time as we all come back together in schools to learn, but schools are a significant source for the spread of infection. So we know staying home when you're sick, covering your cough and sneeze, wiping down high touch surfaces, washing your hands, all of these things are
All right. It looks like Dr. Meyer's frozen up a little bit.
Okay. No problem. Ken, if we're able to get back to Dr. Meyer, let me know. But I'm going to move on. And I want to highlight a recent event that was really remarkable. It was really a special event here in Ohio. And the event is called Guard Care, which is a partnership between the Ohio National Guard, the Ohio Department of Health, and a local health department to bring free health care to the public. Through 2019, Guard Care was an annual event, moving around to different locations throughout Ohio. It started back up this year, August 10th and 11th in Xenia, Ohio, where we partnered with the Greene County Health Department. I was impressed that weekend to see just how many services were provided, including wellness checks and lab work, vision and hearing screenings, and connecting people with a variety of resources, including follow-up care. We have some photos of that we'd like to show you now. Besides helping the public, one of the secondary benefits of the program is that the National Guard members are able to get hands-on experience providing care. And more than 200 service members did so in Xenia. Those service members were able to help over 1,000 community members during that 2-day event. Remote Area Medical produced 311 pairs of eyeglasses, and they made them on the spot right there after people had received their eye exam. The Ohio Department of Health delivered 391 vaccines, and Kettering Health provided more than 500 laboratory specimens and testing services. And all of this was offered at no cost to the patients. Now, we're certainly looking forward to 2025 and having another Guard Care event then as an innovative way to help keep Ohioans healthy. Now, Ken, before we break, let me just check and see if we were able to get Dr. Meyer back.
I think we'll try again. Yes.
I'm so sorry. I'm back.
No. Glad to have you back. So, Dr. Meyer, let me move on and ask, what are some of the other steps that parents can take as we head into the new school year to help ensure that their children really stay healthy, stay well, and so are set up for success in this school year?
Well, the start of the school year is such an important time to make sure that everybody in the family is up to date on preventive services. So starting with your primary care physician who can make sure that you're getting up to date on all preventive services. That can mean vision, hearing, screening, dental screenings, those vaccinations, which we know are so important. So really making sure you're checking in with primary care where they can make sure any acute or chronic illnesses are well managed. Make sure if your child needs any supports for their learning, that those can be in place in the classroom. But parents really set the foundation for healthy routines and patterns of behavior. They model those for their children and create wonderful environments to support healthy nutrition and physical activity, and sleep is so important for learning, as well as setting some restrictions on screen time and making sure that students are really ready to engage in their learning and be successful in school this year.
Well, let me just ask you one more question, sort of in follow-up to those very good points. Another component of staying healthy, of course, is our children's behavioral health. And I have been impressed to see just how good many of our school-based health clinics are at addressing some of those health issues. You know, Governor DeWine has made a major commitment to creating or expanding school-based health clinics in Ohio over the past few years. What kind of impact are you seeing school-based health clinics make in the lives of the children that you care for, particularly as it relates to their behavioral health?
School-based health centers have been absolutely critical in making sure that everyone has access to the services that they need. And I think our school partners are so grateful for all the services that are provided in school-based health centers, whether that's increasing our vaccination rates, which we know are so important at keeping everybody healthy in school, offering services for staff to keep staff healthy. But as you said, I think our parents are so grateful for the behavioral health services provided in school-based health services. They just see the important benefit that this plays for their children in their children's emotional health. And then I think as somebody who's providing primary care in a school-based health center, when we see our students who have graduated and are off in the community, in their jobs and careers, off in college, and they come back to us to let us know that they weren't really sure they were going to graduate, and that the supports available through the school-based health centers made sure that they were able to stay in school and on track for graduation. And I think that that's when we know we really are having such a significant impact for children and for communities.
Thank you so much. I really appreciate it, Dr. Meyer. Ken, I think we're ready to take questions.
Okay, thank you, Dr. Vanderhoff. A reminder to please only ask one question. And our first question today comes from Joe Ingles, Ohio Public Radio and Television.
Thank you, Dr. Vanderhoff, and the other doctors. I would like to ask you about West Nile virus. Are we seeing any cases of West Nile virus in Ohio, and what should people be looking out for?
Wonderful. Very important and timely question. The important initial thing I would tell you is that remarkably, this year, we've actually not had a case of West Nile virus in a human in Ohio. Now, let's think a little bit about West Nile virus. West Nile virus occurs in Ohio during our mosquito season, which is largely May through October. And during that time, the Ohio Department of Health conducts trapping and testing of mosquitoes all over the state. And the purpose of that is we want to be able to detect if that and other mosquito-borne diseases are present in the state. And by the way, the most common virus we detect is in fact West Nile virus. As of August 23rd, West Nile virus has been detected in our mosquito pools in 38 counties, geographically scattered all over the state. Now, as I noted, we had no human cases, though over the past 5 years, we've averaged about 8 cases of West Nile virus in Ohio every year. Now, it's important for people to bear in mind that about 80% of the people who are infected with West Nile will never show any symptoms. Those who do develop symptoms usually do so between about 2 days and 2 weeks after they were bitten by an infected mosquito. Now, among the 20% who become infected and develop symptoms, those symptoms can last a few days or several weeks, and they include fever, headache, body aches, nausea, vomiting. They can have swollen lymph glands, maybe even a rash. Unfortunately, we don't have a treatment. Care is symptomatic. So your best defense against West Nile virus is to avoid mosquito bites. And there are a number of fairly straightforward things we all can do. We have these on our website if you want to go there for more information, but I'll just hit a few. First, it's really a good idea to use EPA-registered mosquito and insect repellents if you're going to be outdoors for any period of time. Also, we recommend that you wear light-colored clothing, long sleeves. Now, I know that's hard if you've got really high temperatures like today. Long pants and socks when you're outdoors. Again, covering as much of your body with clothing that will be a deterrent to those mosquitoes. Also, consider avoiding your outdoor activities during peak mosquito biting hours, which are those dusk and dawn hours. And then finally, take steps to reduce the likelihood that you're going to have mosquitoes in and around your home by emptying any standing water that could be on your property on a regular basis. Dr. Gastaldo, you're an ID doc. This is right up your alley. Did I miss anything? Is there anything you'd add?
Dr. Vanderhoff, I think you hit everything. Again, a lot of it is mosquito avoidance, protection measures, as you just mentioned, and also too, really getting rid of those stagnant areas of water around your household. A bird feeder, for example, is the classic place where we have stagnant water.
Thank you.
Okay, our final question today comes from Xavier Hershovitz, WHIO TV.
Hello, doctors. Thanks for having us, Dr. Vanderhoff.
Yeah.
My question comes with the reporting of cases. I know you talked about the uptick we've seen in the last several weeks when it comes to COVID cases. But I'm curious, how are those cases reported now that so many people are doing those at-home tests? And do you believe that the number of cases that are reported may actually be underreported?
Yeah, I think that's a great question. And it's absolutely the case that we don't have the level of automatic reporting that we had earlier in the pandemic. And largely because, as you note, many people are identifying the fact that they have COVID-19 using a home-based test. And so we're not getting all of those reports. But in Ohio, we have another good source of information that I follow very, very closely and is also available for the public. We do share this information, and that is what we see through our wastewater detection. And it gives us a really good handle on the activity that we're seeing around the state in terms of COVID-19. And that is showing a very similar trend to these numbers that we're seeing. Now, it may not be an apples to apples comparison to our COVID-19 numbers that we were reporting, let's say, more than a year ago. But it's a pretty good comparison because we've had the exact same reporting conditions earlier in this calendar year. So as we look back over the past calendar year, I think the numbers we're seeing are a fair comparison to the numbers we were seeing roughly a year ago, and certainly to what we were seeing in the January timeframe. Nevertheless, I want to emphasize it's not the only source of information in public health we monitor. We also carefully monitor trends that we see through our wastewater detection. And those have been a pretty good indicator of whether we're seeing a rise or a decline. We clearly have been seeing a modest rise, much by the way, as we were this time last year, where we were seeing a modest rise. But we will continue to watch that closely. Dr. Gastaldo, you're a physician who works very closely with, of course, patients who end up hospitalized, not so much involved with the public health monitoring, but do you have any other perspective that you might want to offer?
Yeah, thank you, Dr. Vanderhoff. I could tell you another thing that we look at is the amount of patients who are hospitalized because of COVID-19. And we are seeing a minor uptick. There is no issues at all with the bed capacity like we had previously earlier on in the pandemic. So that as a lagging indicator is quite useful for us that we look at too. And when there's an increase in that, you know there's more COVID out there in the community. Anecdotally, I could tell you too, at Ohio Health, we do a lot of testing that encompasses a big part of the state of Ohio. And we look at our positivity rate of the testing throughout the whole totality of Ohio Health. And we can kind of get an ebb and flow of what's going on out there just based on that.
All right, we're going to squeeze in one more question today. It comes from Samantha Hendrickson with the Columbus Dispatch.
Hello.
I'm glad that we had time. Thanks, Ken. I'm wondering, Dr. Vanderhoff, if you could expound a little bit more about why people should be getting this particular vaccine, even though it's not necessarily targeting the, forgive me if this is the wrong number sequence, but KP3.3.1. I know some of our readers have had questions about that. Why still get this vaccine, and how effective is it still against these new strains?
It's a very, very good question. And I'll return to a little bit of the information that I shared in my opening. And that is that the good news is that the new vaccine actually it does include some of the changes that we see in currently circulating variants, including the KP2. However, admittedly, it does not have every circulating variant. But what we have seen with these circulating variants is, in many circumstances, these cousins of each other, remember, these are all Omicron variants, they're in a family. And many of them have very similar mutations that are impacting similar domains or areas of the spike protein that is so important to this virus's ability to cause infection. So we have very good reason to believe that there's tremendous overlap in terms of the benefit that this vaccine offers to our immune system in essentially giving it an update on what it should be looking for and ready to respond to. Again, I have the benefit of having an infectious disease doctor on as my guest today. And so, Dr. Gastaldo, I'll turn again to you. What might you add to that?
Yeah, thank you, Dr. Vanderhoff. And again, I'll use the same analogy as the influenza vaccine. The vaccine has broad-based immunity. What we're seeing now with COVID-19 is they are all close cousins. And if you get protection from the COVID-19 vaccine, it is broad-based, really covering what we expect to be even the next evolution of where we think we're going with the new variants. And again, that's going to continue to happen. And what we do is we have smart people in the country, virologists, experts in their areas, make the best prediction on where we think we're going with the next variant. And that same model we've had in place for years for influenza.
Okay, we want to thank everyone again for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
Thank you again for joining us. We really do appreciate your interest and the wonderful questions that you ask. So thanks again. We'll look forward to the next time.
All right, this will conclude today's press conference. Thank you.